Good morning. Our today's topic is Spongia tosta, commonly known as Spongia in our homeopathic practice. The medicine is prepared from animal kingdom. The medicine is proved by Hahnemann himself. It is prepared from roasted spongia, turned over a glowing charcoal unit. It becomes brown and be triturated to powder. The conventional use of spongia for goiter is being noted earlier, but Hahnemann himself, with his fellow prover, proved this medicine and incorporated in Materia Medica pura. In first edition, it was about 316 symptoms. In second edition, it is 391 symptoms. In true sense, as spongia having no toxicological records, from that perspective, we may say very safely that Spongia tosta is a pure homeopathic drug. If we consider spongia as a substance, drug substance, actually it is a marine invertebrate animals of the phylum Poriferae. It characteristically have a porous skeleton, usually containing intricate system of canals that is composed of fibrous material, of siliceous and calcareous spicules. Regarding spongia, Hahnemann cited, where the ordinary practitioner still employed roasted the cure of goiter, they gave it in doses of half to whole dram daily, mixed with pepper, etc. On the other hand, I found 1 or 2 doses of the smallest portion of a drop of the tincture, several times diluted, quite sufficient for curative purpose. Now, if we consider adaptability, often indicated for patients of tubercular diathesis. Tubercular diathesis means having family history of tuberculosis and they are having tendency to take cold easily. Mostly they known as belongs to tubercular diathesis. Children generally with fair complexion, lax fiber, swollen glands, and favorable action especially on thyroid gland. Exhausted easily after slight exertion with orgasm of blood in chest and face. Generally they are very anxious and suffering from difficulty of breathing. Kent said in his Materia Medica, it is especially related to cases where there is a pain and sense of stiffness and fullness in the cardiac region, in the chest, with dyspnea, anxiety, fear of death, fear of future, fear that something dreadful is going to happen, and awakens at night in great fear, and it is some time before he can rationalize about his surroundings. So, in short, if we like to elaborate spongia as per Kent's idea, patients having trouble of stuffiness and fullness in cardiac region with dyspnea, anxiety, fear of death, fear of future, that something dreadful is going to happen. Now we are telling about the sphere of action. Spongia is a remedy especially marked in the symptom of the respiratory organs. Actually, spongia is famous in homeopathic field for its efficacy in respiratory trouble, especially acute attack of bronchial asthma and dyspnea. Heart affection, especially in valvular complication after the consequences of rheumatic arthritis. It also acts on glands, not only a thyroid gland, cervical glands, testes, ovary. Apart from that, spongia having also specific affection on larynx and trachea, those who are tubercular diathesis Even they may suffer from laryngeal tuberculosis, those who are Spongia patient. Now you just see, I am presenting a picture of Spongia and on the another side the bronchial tubes. This picture of sponge collected from C exhibits as good as it looks like cross section of bronchial tubes. So from doctrine of signature, if we consider Spongia is a medicine for respiratory trouble. Regarding appearance, face distaste in croup, they are very anxious, livid, pale, blotted, blue and sunken eyes, red with anxious expression, those who are fair complexion. This may be alternately red and pale. Now I am telling about the mental attitude of a Spongia patient. Generally, they are ill-humored. He spoke and answered very unwillingly. He is ill-humored and idle. He prefers to take rest. He is but little disposed to speak. Mostly they are taciturn. Hardly they like to speak about and discontent in mood. Not disposed to talk, like another medicine in our homeopathic Medica, you will learn later on, the bacillum. Alternate gay and lachrymose and cross, quarrelsome humor. In another part, if we consider regarding intelligence, comprehension, concentration, they are mentally dull and difficult comprehension. In selected patient, during proving, Hahnemann observed, they are having irresistible desire to sing, followed by sadness and indisposed to work. In initial phase, they are having happiness, irresistible desire to sing, followed by sadness. Paroxysm of anxiety, anguish in cardiac region, crazy feeling, head feels blown up, anxiety and fear, every excitement, mental excitement causing increase of cough. Now I am telling about the affection of glands, rather space of Spongia in glandular affection. Glands are gradually enlarged, become enlargedly, then hard, and that also may hypertrophy. Thyroid gland swollen, even in selected cases up to chin it may come. At night with suffocating spells, barking cough, with stinging in throat and soreness. Hypertrophy of thyroid, especially when heart is affected in toxic thyrotoxicity, they may suffer from protruding eyes. Cervical glands may also be enlarged. Inveterate case of enlarged testes, orchitis from suppressed gonorrhea, that is also hard, gradually increasing hardness of testes. Now head and vertigo, vertigo with danger of falling, especially at night when awaking, vertigo that he may falls out. When sitting, as if head would fall to one side, with a feeling of heat in head, with the heart with rush of blood to head. Heaviness and fullness of head as if blood were mounting to head with vertigo. Rush of blood into head. Headache, especially discomfort in forehead. Sharp stitches externally, especially in left temple, extending to forehead. While lying, feels a strong pulsation on the head, on the ear, on the side, wherever he lies. Lacrimation and headache while looking fixedly to anything. Lacrimation with headache. Kent said in the occiput, in the forehead, congestive headache, but most of them are associated with goiter, cardiac affection and asthma. So, Headache is a common accompaniment of cardiac trouble of Spongia patient, asthma of Spongia patient, and also goiter of Spongia patient. Now, nose symptom, fluent coryza, alternating stoppage, dryness, and dry nasal catarrh. Along with coryza, there is a dullness and sensation of gloominess over the root of the nose. There is a dullness. Tense constrictive sensation above root of the nose, coryza fluent, with hoarseness, croupy cough, after dry cold winds, with chills, even with measles. Now throat. Stitches and dryness in the throat with burning and stinging, sore throat, worse after eating sweet things. Tickling causes cough. Clear throat constantly like that. Hawking. Continually very bitter taste deep in throat but not in mouth. Laryngeal troubles with great hoarseness in individual tending to laryngeal tuberculosis. The patient takes an acute cold, it settles in larynx and then followed by hoarseness. The larynx is also very sensitive to touch in croup. Whenever we examine the thyroid gland, they may suffer from cough. Even on touching trachea, it's developed coughs. Now tongue and taste, bitter taste in mouth, but it is only in throat, not in mouth. Dry tongue with chill, tongue brown, dry and red. Vesicles at edge of the tongue with soreness. Mouth and tongue full of vesicles with burning, stinging pains. I cannot eat solid foods also. Now stomach symptom, otherwise appetite is good. Generally they are thirsty. Thirstlessness, rarely thirst with chill. Generally thirsty, but they are not having any thirst during chill stage. But it is thirst, but it is only able to swallow small quantity with difficulty. Then I am telling about male genitalia. Already I have told the sphere of action part, that it is having affinity for testis gland, especially after suppressed gonorrhea, swelling up spermatic cord and testicles with pain and tenderness, heat in genital parts, drawing painful stitches extending from body through glans penis, voluptuous itching at point of glans penis for several hours. Even due to voluptuous itching, they are compelled to urge to rub the part. Itching, burning in scrotum and body of penis, especially male-treated orchitis, also after checked gonorrhea, enlarged and hardened testes. Even cord also may be thickened and hard. Now female genitalia, before menses, pain in sacrum with hunger, palpitation during menses. Wakes with suffocating pulse. Most accompaniment of Spongia patient in female genitalia is pain in sacrum. It may be menstrual symptom, it may be amenorrhea, it may be suppressed menstruation, catamnia suppressed in any way, with pain in sacrum and palpitation. In selected cases, we are also getting amenorrhea with asthmatic trouble. Before menses, colic, backache, and with good hunger and palpitation. During menses, drawing in all limbs and awakes with suffocating spells. Now I am coming the chief affection of Spongia, the respiratory system. Difficulty of drawing the breath. To take inspiration is very difficult, as if a cork were sticking in the larynx and the breath could not penetrate to the narrowed orifice of the larynx. It was the experience of our master Hahnemann. When he proved this drug, he felt so difficulty of drawing the breath as if cork were sticking in the larynx, and the breath could not penetrate through the narrow orifice of the larynx. Dryness of the air passes with whistling and wheezing, seldom rattling. In Spongia, hardly we get rattling. Must sit up and bend forward. At times, after great dyspnea, white, tough mucus forms in the air passes, difficult to expectorate. Hardly they expectorate, but if they expectorate, it is tough mucus, white mucus. It comes up and often has to be swallowed. It is so scanty and so sticky. After repeated cough, it may come up in throat, but has to be swallowed again. Now you just see a demonstration of spongia cough. When the patient is suffering from bronchial asthma, how they are coughing, you just see. Now dyspnea, while worse lying down, spongia is a remedy when dyspnea and cough are relieved by warm food. Maybe better from warm drinks, but patient is hot. Dry spasmodic cough, troublesome cough, cold things taken into the stomach aggravates cough, but it is better from cold water. But the cough is worse. If the room becomes too warm, there is a dry, tickling, teasing cough, spasmodic cough. Croupy cough sounds like a saw driven through a board. When patient is suffering from croupy cough, the sound of the cough like a saw driven through a board, better on awakening out of sleep. Each cough corresponding to a thrust of the saw like that. Awakens out of sleep with a sense of suffocation, with violent loud cough, agitation, anxiety, and great difficulty to take breath. In cardiac and asthmatic troubles, it resembles like lachesis. In the arousing up from sleep in suffocation, and after the sleep, the dyspnea is worse. The dyspnea is often increased after sleeping with suffocation. Has it in a marked degree. In tuberculosis, when the patient is about to die, there is sweat going to sleep, then dyspnea going to sleep and on awaking. Now I am telling the relationship of aconite, spongia, hypersulf and phosphorus. If we consider the causation, both for spongia and aconite, they are very similar. Getting exposure in dry cold, and both the medicine also excites the heart, brings on anxiety, fear, restlessness, fear of death. In aconite, patient is very much anxious and excited, and generally it is associated with a marked febrile excitement. Spongia has febrile excitement in a minimum degree, but it is much deeper in its action in respiratory field. The two are very similar in croup, but spongia is deeper. Aconite is very rapid onset, but in case of spongia it is slower onset, taking several days for development of symptom. Aconite is from exposure to dry cold, takes a cold 2 days, and of course come down with croup 2 nights in the first sleep. But in case of spongia, before midnight has a dry spasmodic cough, hoarse cough. Spongia has taken a cold yesterday or day before yesterday. First there is roughness and dryness in throat, then sneezing, then chorea, then cough. They are so similar that when aconite only partially controls the condition and it returns on the next night or last and beyond midnight, spongia becomes its natural follower. It may happen. For the first day, when the patient comes to us, we are taking the case very seriously and sincerely, and we got all information similar to aconite. And despite of taking aconite, patient may not recover totally. And cough assisted, dry cough. In that case also, after giving aconite, we may prescribe Spongia. Spongia comes in because it was probably the remedy in the beginning, cases that were succeeding in night, hoarse, barking, crowing before midnight, though it also has a croup after midnight. It is a deep acting remedy, though its complaints sometimes come on suddenly. Then Hipper. Hipper is worse at night and in the morning also. When aconite has apparently controlled, but the croup returns on the next morning with violent cough, dry cough, then we prescribe Spongia. Despite of taking Spongia, cough continued. And in that case, the dry cough now manifested with rattling sound whenever patient is coughing. In that case, we may select Hippersol. For Spongia, dry cough, no rattling. In Hippersol, cough aggravates at night and morning with rattling. So, in first day we may prescribe aconite, then it may continue, then the space of Spongia comes. Then if after taking Spongia, it may continue and ultimately manifested with rattling, then Hippersol will be the remedy. If the child wants to be covered, said that he is chilly, the Hippersol will be more indicated. If it says the room is too warm and kicks up the covers, in selected case, the calcarea salve may be needed. If audible rattling is there, but without congestion in chest, patient is hot, the medicine would be Kali salve. The Spongia patient is worse from a warm room, from heat, wants to be cool, like iodine, but is better from warm drinks. After the croup become loose, but still remaining, its croupy sound, Hippersol comes in, especially if inclined to get worse after midnight and the morning. If this inclines to relapse once again and get little more croupy every evening, then the medicine will be phosphorus. It will finish the case. Now I am telling about the heart symptom. Hypertrophy of the heart. Spongia has cured endocarditis, cardiac croup, and many other inflammatory diseases of the heart resulting from rheumatism. The patient, those who have suffered from rheumatic arthritis in childhood and now suffering from valvular complication of heart, especially thickening of the valve, with asthmatic trouble like cardiac asthma, dyspnea, in that cases, we may think for Spongia. In respiratory trouble, when patient is suffering from dyspnea, for Spongia, the expectoration is very poor. But when it is cardiac, the affection is accompanied with thick green-yellow expectoration like pus. So in Spongia patient is suffering from dyspnea. If the expectoration is less, cough is dry and violent cough, we may think for bronchial asthma. Patient is suffering from dyspnea, cough is there but not so dry with green-yellow expectoration, we may think for cardiac trouble. The difficulty is respiration is a keynote and is frequently met in valvular affection. No remedy, not even lachesis can do better here. Not only are this paroxysm relieved or stopped, but valvular murmurs of years standing has disappeared under the action of Spongia. I cannot lie with head low, it is a characteristic symptom, or sleep into paroxysm. Dyspnea during sleep like lachesis. The dry chronic sympathetic cough of organic heart disease is oftener and more permanently relieved by this remedy with sense of suffocation after sleep. Awakens out in sleep from a sense of suffocation with violent loud cough, agitation and anxiety. Now I am telling a typical symptom of spongia. In our practice, whenever we are treating especially bronchial asthma patient, some of them may have accompanied with skin trouble. In those cases, whenever they are telling about skin trouble, we switch over to another remedy if we do not know the skin symptom of spongia. In spongia, there are two types of skin eruption. One type is herpes, tinea-like eruption, circular tinea-like eruption with itching. Another is itching without eruption. Seems as if always ready for eruption to appear, but actually it does not appear. Itching all over the body, no visible eruption. During cold attack, there arises an itching, biting on breast, epigastrium, back, beneath and upper arms. At other times, it is only on the feet. It is written in Herring's guiding symptom. During cold attack, skin symptom appears in upper part of the body mostly. In other times, that skin symptom continued on the feet. Rubbing makes spot red, which seems to bite more severely for a short time. Vesicles arise on the spot, which however soon vanish again. Itching without eruption is a very important accompaniment of spongia patient, those who are suffering from bronchial asthma. Now modalities, aggravation from lying down. The modality is common to its other complaints in headache, in respiratory trouble, in cardiac trouble, in all cases. It is being aggravated when lying down. Holding the head in the upright position relieves the dull pressure in the occiput, especially in headache. Sitting erect modality, amylodation, we are also getting in belladonna. The symptom of circulation are worse from mental lassitude, from coughing, from lying on the right side, before menses, after lying down, sitting bent forward, from smoking, from going upstairs. There are different factors for aggravation. Lying down on right side, before menses, sitting bent forward, smoking and going upstairs. Awakens in fright and feels as if suffocating. Feels asleep early at night and suffocation awakens. The most powerful antidote of this medicine is camphor. It is not written in common Materia Medica. It is written in Hahnemann's Materia Medica pura. If we give spongia indiscriminately to any case, and if the symptom aggravates, the only antidotal medicine is camphor. If we consider the comparison, already we have compared aconite, hypersulf and phosphorus. The three medicine is very close and similar to spongia. In chronic cases, as spongia is a medicine adapted for tubercular diathesis, to conclude the treatment, patient, those who are getting relief with spongia repeatedly but not cured, we may think for RSIOD, we may think for tuberculinum, we may think for bacillinum, even we may think for sorinum. But if we get the totality of spongia from adaptability and symptom and characteristic symptoms and modality, spongia itself will cure the cases. Thank all of you. Thanks.